Decompression.
My name is Sherry, and we're going to be talking with several patients who've been struck with the debilitating condition known as low back pain. Statistics show 8 out of 10 people will experience significant lower back pain at some point in their lives, and billions are spent trying to treat this condition. Unfortunately, the majority of this treatment consists of pharmaceuticals and surgery, which exposes an individual to dangerous and harmful side effects, which are not successful long term. Finally, there is a better solution. Lordex decompression therapy's sole function is to restore function and health to the low back. Dr. Eric Strelo has been very pleased with the results his patients are having with Lordex.
We have experienced a very high success rate simply because 90% of low back pain is a result of a mechanical spinal pathology. This mechanical spinal problem is oftentimes a result of either A, acute traumatic injuries such as auto accidents, work injuries, sports injuries, or lifting injuries, or B, chronic degeneration over time, which can be related to age, physical deconditioning, compressive loads over time such as gravity, poor ergonomics at work or home, and congenital or genetic factors. First, we have over-the-counter medications, we have prescribed pharmaceuticals, we have physical therapy, chiropractic adjustments, and steroid injections. All of these might offer some pain control. However, it will most likely be minimal, and the results will most certainly be temporary. The primary reason for this is that the root problem or the primary problem is usually not being addressed, which is the disc. And until that disc is directly addressed, the problem will remain and will most likely continue to get worse over time. There are essentially two ways to address the disc, and that is through decompression therapy or surgery, both of which are attempting to achieve similar end results. However, there is a stark contrast in the means in which to achieve those results. Surgery is an invasive open procedure. Decompression therapy is a non-invasive closed procedure. Surgery is high cost and high risk. Decompression therapy is low cost and low risk. Therefore, in order to restore the back to its optimum spinal function, several things need to happen. First, there needs to be an unloading or an uncompressing of the affected disc, joints, and nerves. Secondly, there needs to be a rehydration of the affected disc, and that is done through a gentle unloading and loading on that disc over a given period of time. And essentially that is going to create a vacuum and suck back in nutrient-dense spinal fluid back into the disc. That is critical for healing and repair to begin to happen in that disc. And lastly, there needs to be a restoration of the stability of the spine. And that is done with our unique high-tech machine that basically targets and isolates specific muscles in and around that affected disc. The Lordex 3000 decompression provides all of this. Is it going to save every low back from surgery? Absolutely not. Is it going to give you a new disc? Absolutely not. However, I can confidently sit here and tell you that we have a 90 to 95% success rate with the Lordex 3000 decompression therapy.
I want to introduce you to Mark and his wife Lydia. Mark had debilitating lower back pain, and an MRI confirmed he had 3 herniated discs. Mark was told his options were limited, but after hearing about Lordex, Mark wanted to try this option first with the goal to avoid surgery.
My quality of life was limited. Most of the things that I would do normally were virtually unable to be done given the situation I was in. The walking in my job is critical. I do a lot of walking, a lot of running, a lot of movements from side to side, picking stuff up, twisting, bending, and it makes things very difficult given the pain I was dealing with every day.
He limped. His range of motion was very limited. He couldn't, play any games with the girls, and we couldn't really go anywhere because sitting in the car was just way too painful for him. And he looked like an old man.
The treatment is a little intense at first. It takes a little bit of time to get used to. It's intimidating, but you're not going to get instant response from this piece of equipment. You can't get on it and expect to get back off of it and be healed. It takes time. The procedure of 40 treatments was absolutely necessary in my case to better my situation. Getting on the machine, you're strapped down. It's a little tight, but the actual procedure feels great. It feels good. You can feel that things are happening. After the treatment has been completed, I don't limp anymore. I walk perfect. I can run. I sleep better. My temperament is much better. I have a lot more patience with everything because I don't hurt anymore. So overall, I would do this again in a second. I mean, it beats surgery hands down. That's what I didn't want to do, was have a surgery. Dealing with Dr. Eric and Lordex is really the only way to cure the problems that I'm dealing with. And so yeah, I would recommend this to anybody dealing with the same kind of problems I have.
I now want to introduce you to Diona. Diona has been in several car accidents and has experienced pain in her everyday life.
Yes, the condition that I've been living with recently has involved pain on a daily basis. It was so bad that even just turning in my bed would send excruciating pain across my low back. At one point in time, I was unbeknownst to me, but I would favor my leg and just walk on my big toe, and it was with a little bit of a limp. Now I'm almost to the point where I'm back to where I was with just a little bit of maintenance. I think going forward, it's going to be it's a life-changing experience for me. It was a moment of decision: do I have surgery or do I go through and stay the course with the Lordex? And I'm so happy that I stayed the course with the Lordex. Everything about this office is, it just makes the patient feel comfortable and valued, and I was treated better here after my accident as a triage versus when I went to the emergency room, and I think that says a lot.
Next, I would like to introduce you to Jay. Jay's work is physically demanding, and in most recent years, the pain has caused him to suffer from sleep deprivation and has kept him from living an active lifestyle.
Well, I've been experiencing back pain for about 14 years now. The frustrations that I have had have been not being able to sleep through the night, and also I'm a very active person, and when I would participate in sports, my back would stiffen up to the point where I would hardly even be able to move. Well, the most marked difference is that I am now sleeping through the night instead of waking up 5 to 10 times per night. I can actually wake up in the mornings and feel good. My back is not stiff, and I'm ready for my day to begin. I also am not experiencing the shooting pain down my left leg. I would definitely recommend Lordex decompression therapy to anybody that is experiencing lower back pain. I actually was contemplating back surgery for years, but was scared to do it because of the horror stories that I have heard. Then I heard about Lordex. I was a little skeptical at first, but then after the second week seeing results, I was convinced that it was the way to go.
As you can see, Lordex decompression therapy has helped many of our patients with their lower back pain. For more information, please visit our website at nwinjuryrehab.com or call us at 360-573-1933. Thank you.